you are a veteran who qualifies for VA healthcare, should you sign up for Medicare Part B? And if you already have, should you keep it, keep paying for it, or should you drop it? I'll talk about it in this video. Hi, I'm Sylvia Gordon with the Medicare Family. My family's here to help your family with your Medicare questions. It's free to talk to us. It's free to work with us. You never pay extra to have a live agent. So if you have questions in this video, you can hit them in the comments down below, or you can email us or call us, and we are happy to help you with your questions about VA healthcare, a topic near and dear to my heart, as my husband served 30 years in the military and his father served even longer, and they have a proud history of military service. And right now, it's kind of secret, but my daughter and her boyfriend are thinking about doing the reserves of the Guard. So it's a big talk at my family right now, and everybody's really excited because that'd be like 5th generation. So, VA. And I fought this fight many times with my father-in-law. I said, you need to also get Medicare Part B and get a Part D plan. And he's like, nope, I served 30 years in the military. I have free health care in the VA. By God, I'm not going to pay a dime for private coverage. I'm going to the VA. Right? Have you heard that? My cameraman shaking his head. Yes. These guys are stubborn. Okay. And I said, that's great. They have care for you available, and it's not completely free. That's a myth. It's depending on your service disability and your income, a lot of different things. But it's very, very low cost, okay? So yes, you do have access to it. My number one objection as the daughter-in-law was the nearest VA facility is an hour away. So I don't want you driving on the highway for an hour at your advanced age. Not good driving at that point, right? And the highway gets busier every year. And you don't want me to drive you because you want to be independent. So I want you to have the option of having a private plan. So if you just want to zip down the road where our primary care doctor is a mile from our house and you just want to rush into her, that your private insurance will allow you to do that. Now, there is such a thing called the community care program through the VA where they will pay for you to go to a doctor, a private doctor on the economy. However, there is a rumor that might not continue to be funded past 2021. And you know, those footballs are always getting passed around. Is it going to be funded? Is it extended? Whatever. So there were many years where they typically had they had the program, but nobody could use it, even though it was funded. There were so many barriers to it. So I'm like, I can get you a very inexpensive Medicare Advantage program with a 0 monthly premium, which means if you don't use it, you're not paying for it. So get all your care from the VA. But if you ever need it, because the VA has, shocking, a backlog, or they might not have the top specialists, whatever illness you have, and you want to go to a private doctor, you will have the flexibility, and you're buying a Medicare Advantage plan with no monthly premium. So if you don't use it, there's no money out of pocket. You won't be mad at me. So I got him to agree to do that. Now, the drug plan is another one because they're like, I get all my drugs from the VA, and people are very proud about that. I gave my service, and now I get my reward. I want my drugs from the VA, which is great. However, the VA has its own list of drugs, its own formulary. I call it its own recipe. So they don't necessarily cover every drug. So if your doctor really feels that this drug out here is the best for you and the VA doesn't cover it, it's out of pocket. Oh, but wait, you have that insurance plan that will give you drug coverage. So you don't have to use that supplemental insurance program, but if you do, it's there. Now with a drug plan, with Part D, you would pay a copay for that drug. It wouldn't be, like I said, the monthly premium for Med Advantage could be 0. So as much as I want to support people using the VA, and the VA has really come quite a long way in the past 5 years. They've really weathered a bunch of scandals and come out better. We have a deluge of soldiers demanding services because of all the wars we've been in the past 12 years. So it is harder and harder to get in a timely manner. And I know from experience trying to book these appointments. And if you want to get in right away, you might need private insurance. And private insurance might not cost you very much. Monthly premium, you would still pay a copay for a service with Medicare Advantage. Now, I'm not even going to get into how to get them to coordinate and see if the VA will approve this and all that stuff. I'm just going to put it out there that you know if you're getting coverage from the VA, it is a big bureaucracy. If you're not already getting coverage through the VA, I don't want you to think that everybody that serves is eligible, because that's not true either. The application is online. We can help you with it. It is very simple. It's like 2 pages to see if you do qualify. And like I said, certain disabilities, certain service times, and income thresholds to see if you will qualify, and then based on what level you qualify, what your payment would be for your services and for your medications. So there's a lot of misconceptions floating around up there about the VA. Most of my clients that I ask, are you a veteran? Most of them are. And I say, are you signed up through the VA? And they're like, nah, I don't qualify, or I don't want to mess with it, or it's too far. And a lot of them, I say, well, why don't we at least apply? If we can get you in, you have it. You don't have to use it. The same way I say if you are already getting your care from the VA, and I say, let's get some private insurance, you don't have to use it. Same thing. If you love your private insurance and you love your private doctor and you don't want, but you do qualify, let's get you in the system in case you ever need to use it. So thank you. I hope this video was helpful. If there is a question you have concerning VA healthcare, I'd be happy to answer it in the comments or call us.